Coronavirus disease, COVID-19, is an infectious disease caused by the SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads. Protect yourself and others from the infection by staying at least 1 meter apart from others, wearing a properly fitted mask, and washing your hands or using an alcohol-based rub frequently. Get vaccinated when it's your turn and follow local guidance. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to small aerosols. It is important to practice respiratory etiquette, for example, by coughing into a flexed elbow, and to stay home and self-isolate until you recover if you feel unwell. Protect yourself and those around you. Get vaccinated as soon as it's your turn and follow local guidance on vaccination. Keep physical distance of at least 1 meter from others, even if they don't appear to be sick. Avoid crowds and close contact. Wear a properly fitted mask when physical distancing is not possible and in poorly ventilated settings. Clean your hands frequently with alcohol-based hand rub or soap and water. Cover your mouth and nose with a bent elbow or a tissue when you cough or sneeze. Dispose of used tissues immediately and clean hands regularly. If you develop symptoms or test positive for COVID-19, self-isolate until you recover. Wear a mask properly. Make sure your mask covers your nose, mouth, and chin. Clean your hands before you put your mask on, before and after you take it off, and after you touch it at any time. When you take off your mask, store it in a clean plastic bag, and every day either wash it if it's a fabric mask or dispose it in a trash bin if it is a medical mask. Don't use masks with valves. Make your environment safer. Avoid the 3 C's: spaces that are closed, crowded, and involve close contact. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without outdoor air coming in. If you can avoid crowded or indoor settings, take these precautions. Open a window to increase the amount of natural ventilation when indoors. Wear a mask. Keep good hygiene. Regularly and thoroughly clean your hands with either an alcohol-based hand rub or soap and water. This eliminates germs that may be on your hands, including viruses. Cover your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Dispose of used tissue immediately into a closed bin and wash your hands. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets, and phone screens. What to do if you feel unwell? If you have a fever, cough, and difficulty breathing, seek medical attention immediately. Know the full range of symptoms of COVID-19. The most common symptoms of COVID-19 are fever, dry cough, tiredness, and loss of taste or smell. Less common symptoms include aches and pains, headaches, sore throat, red or irritated eyes, diarrhea, a skin rash, or discoloration of fingers or toes. Stay home and self-isolate for 10 days from symptoms onset, plus 3 days after symptoms cease. Call your healthcare provider or hotline for advice. Have someone bring your supplies. If you need to leave your house or have someone near you, Wear a properly fitted mask to avoid infecting others. Keep up to date on the latest information from trusted sources such as WHO or your local and national health authorities. Local and national authorities and public health units are best placed to advise on what people in your area should be doing to protect themselves. Thank you for watching.